Hi, my name is Dr. Rudra Mohan and through the Oral Health channel, today we're going to be talking about the difference between skeletal and dental malocclusion. Let's start. So this is going to be a very brief and a basic episode for all the viewers out there. This is not directed at any dentists, not of any specialty, but just issued in public interest for the public to understand that what is the difference, the basic difference between skeletal malocclusion and dental malocclusion. Now, I get a lot of calls from patients who have been streaming and searching on YouTube and Instagram and on Googling all those their symptoms and everything. And when they have crooked or malaligned teeth, they also get suggestions like orthognathic surgery, mandibular advancement, genioplasty, Lefort osteotomy and all those kind of things. And then they call me up and ask me, sir, can I get this done? Please look at my photo. Is it possible or not? Now, I understand that you are concerned about how you look and how your smile looks, when you smile publicly and all those things, and what is the effect of that on your confidence. But let me tell you something, there is a very big difference between the skeletal malocclusion and a dental malocclusion. Skeletal malocclusion actually in brief means the relation of your upper and lower jaws with respect to each other, even if there are not any discrepancies in the teeth. For example, your upper jaw is the maxilla and the lower jaw is the mandible. It's as simple as that. You have three basic skeletal malocclusion classifications. The class one is that both of them are very much aligned with each other and it's a straight profile. When you look at it from the side, it's a straight profile, and that is known as an orthognathic profile. It's as simple as that. It can have dental malocclusion. A straight skeletal malocclusion profile can have dental malocclusion. That means that the teeth are not biting properly, but the jaws in relation to each other are completely aligned the way they are supposed to be in the natural way. So what is skeletal malocclusion type 2? Very simply, it's a convex profile where your lower jaw is either placed distally or at the back position with respect to the maxillary or the upper jaw. It could be because of the maxilla, the upper jaw being protruded, or the mandible being retruded, or a combination of both. As simple as that. And skeletal class 3 is the reverse. You have mandibular protrusion or maxillary retrusion or a combination of both. Mind you, dental malocclusion can exist in all of these 3 or 6 whatever variants. The 3 major classes, class 1, class 2, class 3, right? For whatever their causes are, dental malocclusion can occur in all of them. And dental malocclusion is actually a much more diverse and varied distribution, which you as a patient don't need to understand about. Whenever you have a concern about your teeth being crooked or malaligned, or you feel that your jaws are not closing properly or the relation between them is kind of haphazard, all you have to do is the first point of contact for you is an orthodontist. That means a braces specialist. That means an aligner specialist. Visit the orthodontic practice, consult with them. If they will take some x-rays, they will take some impressions, they will do some examinations and all the analysis possible. And if they find that there is a skeletal component to your malocclusion, that means the way your jaws bite is completely not attributed to your teeth, it is also attributed to how the jaws are placed, then they will come up with whatever modalities. It could be any sort of orthognathic surgery along with braces, or completely with the lack of one or the absence of the other. That is solely on the discretion of the treating doctors. So what I would really recommend all of you to do is not Google your symptoms and not catastrophize that I have to undergo this surgery and I have to do this, I have to get braces and all those things. Just pick up the phone, call your nearest orthodontist, visit the practice and get yourself checked out. So that was today's episode. Please like, share, subscribe and do press the bell icon for important updates. If you want to get in touch with me, please make sure that you don't call me directly on my WhatsApp number. Drop me a message and here are my social media handles, and then I can get back to you within a day or two, as I might be busy with patients. So that's it for today. Thank you.